Key findings from the 2017 Malawi Malaria Indicator Survey. The 2017 Malawi Malaria Indicator Survey, or MMIS, is designed to provide up-to-date estimates of basic demographic and health indicators related to malaria. The 2017 MMIS is the third malaria indicator survey to be carried out in Malawi as part of the Demographic and Health Surveys, or DHS Program. 3,729 households and 3,860 women aged 15 to 49 were successfully interviewed in the 2017 MMIS. This represents a response rate of more than 99% for both households and women. All children aged 6 to 59 months living in selected households were eligible for anemia and malaria testing. Anemia testing was carried out using the HemoQ system. Malaria testing was done through both rapid diagnostic testing known as RDT as well as blood smear microscopy. Of the 2,304 eligible children, more than 99% provided blood for anemia testing, RDT, and malaria microscopy. Malaria prevalence estimates in this video are based only on microscopy results. The 2017 MMIS provides estimates at the national level, for urban and rural areas, and for each of the 3 administrative regions in Malawi. The results of the 2017 MMIS show that progress has been made in malaria prevention and case management since 2012. Currently, 82% of households in Malawi have at least one insecticide-treated net, or ITN. An ITN is a factory-treated net that does not require any further treatment. The definition of an ITN in the 2012 and 2014 MMIS surveys included nets that had been soaked with insecticides within the past 12 months. ITN ownership has increased since 2012, when only 55% of households owned at least one ITN. Although ownership of ITNs is widespread throughout Malawi, only 42% of households have enough ITNs to cover each household member, assuming one ITN is used by 2 people. 4 in 10 households have at least one ITN, but not enough for all household members, while about 1 in 5 households does not have an ITN. Access to an ITN is a calculation of the proportion of the population that could sleep under an ITN if each ITN in the household were used by up to 2 people. 63% of people in Malawi have access to an ITN, while 55% slept under an ITN the night before the survey. While both ITN access and use have improved since 2012, the gap between ITN access and use has widened between 2014 and 2017. Children under 5 and pregnant women are the groups most vulnerable to malaria. More than 60% of both children under 5 and pregnant women slept under an ITN the night before the survey. Use of ITNs by both children under 5 and pregnant women has increased since 2012, but has stagnated between 2014 and 2017. Malaria during pregnancy contributes to low birth weight, infant mortality, and other complications. To prevent malaria, pregnant women living in Malawi should receive 3 or more doses of SP Fansida during their pregnancy. 92% of pregnant women received at least 1 dose of this intermittent preventive treatment, or IPTP, while 76% of women received 2 or more doses and only 41% received 3 or more doses. Pregnant women receiving at least 3 doses has increased threefold from 13% in 2012 to 41% in 2017. Fever is a major symptom of malaria in children. Overall, 40% of children under 5 had a fever in the 2 weeks before the survey. 54% of children with fever had advice or treatment sought, while only 38% had blood taken from a finger or heel stick for testing. Among children with fever who received an antimalarial, 96% received artemisinin-based combination therapy, or ACT, the recommended drug for treating malaria in children. 5% of children aged 6 to 59 months have low hemoglobin. Prevalence of low hemoglobin has decreased since 2012 when 9% of children aged 6 to 59 months had low hemoglobin. In Malawi, 1 in 4 children aged 6 to 59 months tested positive for malaria by microscopy. Malaria prevalence varies greatly by region. Malaria prevalence is highest in both central and southern regions, both at 26%, and lowest in the northern region at 11%. Malaria prevalence has decreased from 33% in 2014 to 24% in 2017. As you can see, the 2017 Malawi Malaria Indicator Survey provides a wealth of information about malaria in Malawi. Results of the survey show where progress has been made as well as areas for improvement. The 2017 MMIS provides data to inform strategic planning and program evaluation in Malawi. The 2017 Malawi Malaria Indicator Survey was implemented by the Malawi National Malaria Control Program. Financial support for the survey was provided by the United States Agency for International Development through the President's Malaria Initiative. The government of Malawi provided financial assistance in form of personnel, office space, and logistical support. ICF provided technical assistance through the DHS Program, a USAID-funded project offering support and technical assistance in the implementation of population and health surveys in countries worldwide. For additional information on the results of the 2017 MMIS, please contact the National Malaria Control Program in Malawi and the DHS Program in the United States.